and the infertility solutions that is on rise today. So that's my bio. I'm the co-founder of Androplus, and Dr. Priyank Saleja is the founder of Androplus. We've been into the business since last 12 years, and Androplus is a 5-year-old baby. It's pediatric urology, female urology, and male urology. When I say urology, it's directly with the kidneys, with the ureter system, with the penile system, with the female reproductive system. A stone can be located in the kidney. The pictures you can see over here, it can be in the pipe which is connecting the kidney and the ureter. Technology, and it is cutless, painless, a surgery called as RIRS, wherein it's a complete non-invasive. Through the reproductive organ, a probe is inserted and it goes to the stone and it is removed. That's painless, cutless. Okay, these are different surgeries which the urologists, they perform with a minimal non-invasive or a little minimal invasive surgeries, wherein a small cut of only 1 centimeter or 1.5 centimeter is done and you're out of the pain. Okay, so these are some treatments: kidney stones, prostate for the older men, reconstructive urology, patients born with some urological defect with kidneys or reproductive organs, male, female, kids, everything is taken care of. There are different urological services also, that is varicocele treatment or laproscopy. Onco urology also we undertake, wherein we take cancer patients who are suffering from any oncological treatments needed for the kidneys. Coming down to andrology, one of my favorite subject, that is men's health, which matters, which is very much underrated and not spoken about. So we deal into infertility, diagnosis and treatment, wherein we analyze the semen, diagnose it, we give the treatment for the males who are not able to produce children. There is something called as circumcision, wherein we have something called as ZSR stapler, which is again a minimal invasive surgery done with the laser, and the patient comes in the morning, he can go back in the afternoon. There are penile implants, wherein people having erectile dysfunction. Majorly we have our patients from the Middle East who come and do this treatment and have 100% success rates. There is something called as shockwave therapy. Again, we have this instrumentation, advanced instrument, wherein we treat men who are having difficulty in erection. So again, this treatment, and there are these sessions which are taken and 100% recovery is there in that. Again, there are hormonal and sexual health problems. Okay, so talking about andrology, it's not only about surgeries, it's also about medication. So there are hormonal therapies also, depending upon the patient is diagnosed, the treatment is diagnosed, and accordingly medications are also given. So there's testosterone therapy and erectile dysfunction therapy. And let me just take a moment for this. As a female, I know if I have any issue, I need to go to a gynecologist. But males, still the awareness is, it's just the tip of the iceberg, it's huge inside. You have to consult an andrologist. So any of your friends you know who is suffering from any of the problem, please make sure that the person reaches out to an andrologist. He is a male specialized for male infertility. Not only infertility, but the regular psychological sexual problems occurring in males. Okay, coming down to female infertility, we have on board finest of the gynecologists. Now these gynecologists are the infertility specialists assigned for the female. So we have different procedures that the females undergo, and it is taken care completely by the gynecologist on board. This is my forte, wherein IVF. IVF is nothing but producing the baby outside the body. Not going into technicalities, but we have the gametes with us, we fuse them in a laboratory, and then we produce a baby, and again whether it is transferred back into the female system or it is again freezed and kept for the future purposes. So these are a few of the pictures which depicts. Genetic analysis is also done because now the genetics is on rise. There is something called as sperm retrieval and preservation also, the social freezing. that we do, that is semen, oocytes. Oocytes are nothing but the female eggs, and also the embryos that can be freezed for future processes in an IVF treatment or social freezing. A person who cannot produce sperms in an ejaculate cannot become a father. That's a myth to be broken out. Sperms can be retrieved from the testes and the epidermis as well, and the andrologist does that. Androplus, we have collaborated with the hospital list that you can see over here, whether it's offline, right from the branded hospitals to the mid-level hospitals. We covered page 3 patients till Arogyashri patients. So any patient can come to us and we can deal and get the treatment done anywhere they want, along with Androplus. We are recently connected with Diani Beach Hospital in Kenya, and we provide services over there as well. We have our own pharmacy with 45 drugs, including urological drugs and andrological drugs. That's called as Androplus Pharmacy. Our fertility center collaborators are Apollo Fertility, Indira, Lush, Juhi, Womb, Nova, IVF Access. And my gifts are definitely my ideal patients from BNI or referred from BNI, and any medical emergency anyone needs, because we have a vast network of doctors we can deal with. Okay, so at the middle of the night, morning, anytime anyone has any medical emergency, please reach out to me. I can help in the best way I can. These are my referrals that can help me. Please just go through the list that are gynecologists or HR managers, NGOs, community groups, you can please refer me to. These are few of the clippets wherein the surgeries are performed by Dr. Priyank Saleja, and a few of our publications and newspaper outlets. This is again different teams, different presentations we do in the national and international conferences. This is me again along with my team over here. This can be done later on because I'm running short of time. I'll forward this. And this is my latest picture. 2 weeks back we celebrated our success party at Androplus, and this is my team again. So thank you from my team, because I am nothing without my team at Androplus. And the last one, thank you BNI. I want everyone to just have 10 seconds over here. Embrace every interaction as a seed of opportunity. Just like ripples in the pond, your conversation and connections today can create waves for success tomorrow. So together at BNI, we can build empires. Thank you, each one.